Hello everyone, my name is Adil Bashir and I'm a training coordinator and mentor at Attentive Social Enterprise. I've been part of this social enterprise since September of 2018 and I've developed a wide range of life skills through networking opportunities, creative workshops, projects and events. Attentive works in multiple sectors ranging from the public, private, charitable, educational and policing organisations. Today, I would like to discuss anxiety, ADHD and dyslexia through my personal experience within Attentive, the impact these disorders have on people's lives and how they can overcome and manage these challenges that many people face in everyday life. Let's start with anxiety. What is anxiety? Anxiety is another word for when you feel worried, afraid or scared. People can have anxiety at any stage in life. Anxiety is a common reaction to life's events. For example, some of the thoughts that could go through a person's head is the worry of speaking in front of large crowds, overthinking about your job, thinking of the worst possible scenarios that make you want to feel isolated or become an individual that avoids your responsibilities and commitments. You may worry about exams, about family issues, or even about how someone you work with will react to something. There are several different forms of anxiety, including social anxiety, health anxiety, panic disorder, phobias, generalized anxiety disorder, and so on. Some of the symptoms people could face if they suffer with anxiety are hot sweats, shortness of breath, tightness in their chest, shaking, feeling dizzy or lightheaded, feeling nervousness, and fearing they are about to have a heart attack, which could lead them into a state of panic. Anxiety can come on at any time of the day, and sometimes people rely on medication or therapy to learn different coping mechanisms. Anxiety can be managed by lifestyle and diet changes. I am an individual who has personally suffered with this disorder for many years, stemming from being totally unhappy at my job and not feeling accomplished enough while my fellow peers seemed to be flourishing. I was constantly worrying that I was not good enough and had no idea what I wanted to do with my life, which made my anxiety go through the roof. Attentive changed my life. I was fortunate to meet the managing director, Montel, who leads the enterprise. In September of 2018, I was offered the opportunity in education to develop my life skills and uplift my confidence through workshops. It was my first real experience in that setting with a large group of students watching, observing and assisting throughout the session. I got to learn how a workshop is set up, the planning and preparation of the content, the delivery and presentation of the session, and the engagement and feedback of the session. Now, how you can cope with anxiety. Number 1, breathe. In and out and count for a few seconds. Number 2, ask yourself questions. Number 3, question what you're afraid of and keep asking yourself questions until you realize that nothing will actually hurt you. Say you were afraid of talking in public. Why are you afraid? Number 4, why are you afraid or what do you fear? I might make a mistake or say the wrong thing. What would happen if you did that? People could laugh at me. If people laugh at you, what would happen then? I might look stupid and people might not like me. Would you ever not be friends with someone if they said the wrong thing? Probably, not unless they'd said something very mean on purpose. Number 5, I might fail. It could be a test or exam, for example, perhaps, or you could succeed. Now, the second topic is ADHD. What is ADHD? ADHD is known as Attention Deficit Hyperactivity Disorder. It is a condition that includes symptoms such as having short attention spans, getting distracted easily, lack of organizational skills, time management issues, lack of concentration, fidgeting and not being attentive to details and so on. It can be triggered in children as early as 12 years old and sometimes even younger than that. ADHD can show up in 3 different types: inattentive, hyperactive, impulsive and combined. Treatment for attention deficit hyperactivity disorder, known as ADHD, can help relieve the symptoms and make the condition much less of a problem in day-to-day life. ADHD can be treated using medicine or therapy, but a combination of both is often best. Treatment is usually arranged by a specialist, such as a podiatrician or psychiatrist, although the condition may be monitored by a GP. Treating ADHD often requires medical, educational, behavioural, and psychological intervention. This approach to treatment, depending on the age of the individual with ADHD, may include medication, skills training, counselling, behavioural therapy, educational supports, education about and regarding ADHD. Moving on to dyslexia. What is dyslexia? Dyslexia is a learning difficulty that primarily affects the skills involved in accurate and fluent word reading and spelling. Characteristic features of dyslexia are difficulties in phonological awareness, verbal memory, and verbal processing speed. The 4 types of dyslexia include phonological dyslexia, surface dyslexia, rapid naming deficit, and double deficit dyslexia. Everyone experiences dyslexia to different degrees, but there are common indicators. The signs of dyslexia are confusing visually similar words, spelling erratically, finding it hard to scan or skim text, reading and writing slowly, the need to reread paragraphs to understand them, and finding it hard to listen and maintain focus, just to name a few. No medications treat dyslexia. Instead, educational interventions can teach more effective ways to learn and read. Children with dyslexia may work with a trained specialist to learn new reading skills. Sometimes, slowing down a lesson gives a child with dyslexia more time to cover topics. Although dyslexia is a lifelong condition, many people with dyslexia can learn to read and write well. Most people need help from a teacher, tutor, or whoever is presenting information. This is one of the reasons why workshops are more suitable for people with dyslexia, as these involve using a variety of senses, hearing, seeing and doing all at the same time, and allow individuals to move forward at their own pace. Students suffering from dyslexia might need additional emotional support if they feel left behind or not engaged. Good teachers, lecturers and educators can help people with dyslexia by being sympathetic and adapting the environment for the benefit of everyone. Thank you for taking the time to listen. For more information on our content regarding mental health disorders, please visit www.attentive.com. You could also follow us on our social media platforms via Instagram and Facebook by searching Attentive Social Enterprise.